All right, we're here at Premier Health Express Clinic here in Columbia, Maryland. We're actually with Councilman Peter Smith.
Yes,
Got that right.
that's correct.
Okay. Councilman Peter Smith from Anne Arundel County, and he also sits on the Board of Health for the county. Also has a lot of responsibility as it relates to the readiness of our force out of the Fort Meade area as well as for the state of Maryland. And again, had an opportunity to actually tour the Premier Health Express Clinic and see not only is it serving vulnerable populations within our community, but specifically with a focus on veterans.
Yes.
So would love to just hear the councilman's thoughts as he had a chance to walk and tour the facilities of Premier Health Express. What were your thoughts as you saw how this particular setup is and its benefit to the community, specifically when we speak about veterans and their families? I'd like your thoughts.
Okay, so well, one, I'm pleased with the location of it because it's right in the heart of everything that's sort of military here in Central Maryland. Fort Meade, though it resides in Anne Arundel County, it really is a regional asset, and so everyone that's associated with that base lives all over the place. And so several things that jumped right out at me is the fact that the military as a whole certainly has challenges at times trying to meet readiness standards and things like that for a number of different reasons.
Absolutely.
And so whenever we have these public-private partnerships, if you will, to help relieve the pressure on the valves on those issues, I think it helps the military. And
Absolutely.
so the fact that we can now come here to this location to have some of those needs addressed is a good thing, not just for this business or this county, but for the country, because obviously readiness when it comes to the military terms is, that's how we operate.
Absolutely.
So we can't deploy any of these persons if they can even take a physical fitness exam if they don't have a medical evaluation once a year, especially in the Marines. I've spent the last 21 years in the Marines. Reservist now switched over 7 years ago. And so I've seen some of the issues that we've had to face. And so now that this is an opportunity for us to sort of help address some of the Marines' sensitive issues,
Absolutely.
We're certainly going to take advantage of it.
Well, we appreciate that very much, Councilman, and I know we spoke about the readiness of the active force. What are your thoughts on veterans that are obviously been discharged from the military, and do you see that veterans too are looking for a place where they can feel at home that may not be connected to the VA? As we mentioned before, over 70% of veterans are not registered with the VA, but yet because of their service, they may still have some things that have occurred to them either acutely or chronically. And so what are your thoughts about an organization in a place like this and kind of the feel of how do you think veterans will receive this?
Well, it's always good when you have a location that's off the installation as well, because a lot of times the VA just opened up a clinic a couple years ago on Fort Meade.
Right.
But if you are a veteran and you don't have any identification, or you're homeless or something like that, there could be challenges getting on the base.
Right.
So having a location that's off the base that still provides those same services is always a recipe for success. And so anytime we, at least or me, have the ability to sort of educate the installation commanders on, hey, here, have you thought of this resource? I'm certainly going to do it. So when it comes to those veterans who aren't serving, who have been out for a while, they live in a community. You're right. It's tough sometimes trying to understand all the ins and outs of the medical system. And so having a clinic that has a niche sort of market and understanding of the things that veterans go through and how they process their TRICARE or their VA benefits and things like that, that is always a win. And so I'm excited to sort of start pushing that information.
Well, we appreciate it again and again. This is Councilman Smith. We do appreciate his leadership, not only in Anne Arundel County, but specifically for the region. And again, on behalf of the team here at Premier Health Express, again, we appreciate your opportunity and you all participating, and we appreciate also your recognition of veterans during this upcoming or this current Veterans Month. God bless. Talk to you all again soon.